Hi guys, welcome to Freshers Week, Dudley College and Dudley Student Union. This is Wendy Preston. She's from the Royal College of Nursing and she's going to discuss with us and answer questions that you've submitted to us regarding anything health-wise, COVID and actually getting into nursing as a career. So Wendy, I know the story because I've known you many years because I just happened to be married to your brother.
Absolutely.
So I
Family
know
link there.
Yeah, I know the story and I've heard it all before, but can you we all know now that it all started here at Dudley College. So
Absolutely. Dudley College.
yeah.
Dudley College, age 17.
So you're actually technically one of our success stories, as I found out today. So
Okay, that's interesting.
So not only are you a book pool one, you're a Dudley College success story as well. So
Oh, that's nice to know.
There you go.
Thank you. That made me dad pleased. Yeah, so it all started back in 1987 at Dudley College, where I came to do my pre-nursing course, which is probably your health and social care, one of your health and social care courses now. So that was really good. Gave me my GCSEs to be able to access nursing. Now, obviously, it's a little bit different now. You have to have A levels, but in essence, it's very similar. I then went over to Coventry to do my registered general nurse training, which took 3 years, which is the same now. It still is 3 years. Main difference was I did a certificate in nursing because we didn't have diplomas and degrees and masters then. However, over the last 30 years, I think I've graduated 6 times now. I've done diploma, degree, a master's, and then a few other master's level qualifications. Because the beauty of nursing is you can go off and do lots of different things. I could probably give you 1,000 different examples of very different roles and very different jobs that a nurse would do. But it all starts back at that sort of starting journey. And that's what Dudley College really did. Gave me the foundations, gave me the qualifications to then become a nurse. And my jobs now, I'm head of nursing practice for the Royal College of Nursing, usually based in London, but at the moment I'm here still in the West Midlands because we're not travelling anywhere because of COVID. But I cover all nursing and midwifery across the UK. And then I also work locally as a consultant nurse within our local hospital in Nuneaton, and also as an out of hours. So if you ring 111, you might have someone like me to assess you in clinic, as I'm an advanced nurse practitioner. And we maybe want to ask a few questions a bit more about that later. So that was the journey in its shortest form.
Wow. I know you've specialised in respiratory,
the lungs, yes.
So you specialise in that, and that was the avenue that you took. And I know you've written a book or co-wrote a book about that. So talking of respiratory conditions, this is probably one of the underlying conditions that people like myself with asthma have to tend to shield ourselves in a degree because of COVID-19. So can you explain why people with underlying conditions are at that point? Why am they having to shield, basically?
So COVID is a virus, and over the years we've always expected to have a pandemic. We tend to have a pandemic about every 100 years. So we knew, one was going to come. We've had a few sort of times where we've had things like SARS and some other viruses that could have become a pandemic as bad as COVID, but for one reason or another didn't. So sometimes it's sort of what happens is the problem with COVID, it spreads very quickly. And also a lot of people don't know they've got symptoms. They don't know they've got COVID. A lot of people will be walking around spreading it, and you'll see that all the time on the news. Now, the problem, when it first came out, we thought COVID was very much of a respiratory virus, but actually it's very different. It affects all of the systems of the body, but obviously the symptoms that we're all looking for, that cough, that high temperature. And then there's some quite bizarre symptoms that are very common, like loss of smell and loss of taste. So they're all the things that you're looking at. And if you have those symptoms, it's so important then to self-isolate. And that's because, one, you don't know who you're going to be spreading that to. You might just have a cough and a cold, but if you've got a cough and a cold and you've got COVID, then it's going to spread even further.
Yeah.
Hence why we wear a mask, we keep the space, and then obviously you need to social isolate. Now, there's people that are more at risk. So what we saw back in sort of March, April, May, and still now, is the people that were in intensive care, the people that died, the people that were really struggled with COVID were the people that had underlying conditions. And that's not just old people, that's across all ages. Yeah. So if you, if you were, say, particularly men were more at risk, it's actually equaled out a little bit now. But if you were, had a little bit of extra weight on, and you've got an underlying condition, so asthma, diabetes is one actually that's higher at causing problems. Then so if you're male, in your sort of 40s and 50s, and I've got diabetes, you were a lot higher risk that if you had COVID, you would end up either in intensive care or worse. And we lost, over 450 doctors, nurses, healthcare professions from COVID. So, it is really, for those that think it's a big conspiracy and it doesn't exist, it is real. And, I've seen it, all of my nursing colleagues have seen it, and it petrifies us that we could end up with another spike similar to what we've had a few months ago. And what we're hoping is that the new measures, and that particularly, everybody sticks to the rules, because you might not know you've got COVID and you might go merrily along spreading it around. You might go back home and have a relative who has got, say, diabetes, asthma, etc., pass it on to them, and then they could be very ill or worse, die. So doom and gloom, I'm afraid.
Oh no, not good, is it really? So if you think you've got, let's say, you think you've got the symptoms of COVID, what is your best course of action?
So if you've got symptoms, so it depends what the symptoms are. So obviously, if you think you've got symptoms, you're just feeling a little bit unwell, you've got a cough or you've got a temperature, and you just feel a little bit under the weather, then ring 119, which is the national phone number that can arrange a test for you. Or you can go online, and they'll have usually a bit of a checklist to see whether your symptoms are concerning, or and they'll advise you whether you need a test. You can also report your symptoms. So lots of us now have got apps. If you've got the new app, Test and Trace app that was launched yesterday, on there you can report symptoms, and it will advise you, oh, these symptoms are worrying, you need to have a test. So use the technology that we've got to help. If you are feeling unwell and need further advice, you can ring 111. So 111 is more for the clinical side of it, and thinking, oh, actually, I'm concerned. Do I need to go and seek medical attention or not? So they're the two numbers, and people get a little bit confused on what 119 is, and that's really if you're needing to be organising a test, or you're not sure.
Oh, that's really good, and it's good that you've cleared that up, because a lot of people, as you said, will get the two confused. I'm just having a quick look at some of these questions that we've had from students. So obviously we've gone over the masks and how important that is, because that is protecting other people, not actually protecting yourself. You said in our last video, obviously, why wearing a mask is so important and how you should wear a mask. Can you just go over that again for me, please, Wendy?
Okay, so really important, because at that we all wear masks because we're all protecting other people, and if we all do that, then that's protecting ourselves, because if everybody's wearing a mask, the key thing with your mask is it's got to cover your nose and it's got to cover your mouth. It's got to have a good fit, and particularly if you've got glasses like me, you want to push that. If you've got a little bit of the metal bit, the surgical bit, pop that around. Or if you're like me, if I've got some material masks, I've actually taken, the little bit out of a blue mask, the surgical disposable masks, and I've sewn it in so that I can get that good fit around my eyes, because that's when you get steamed up glasses. Also needs to come all the way, so all the way from here, all the way down past your chin. What we don't want to see is when you've not got your mask on, that it's sitting here on your neck, because your mask sit here, the bugs sit here, and then if you pull it down, when you put it back up, you're moving all those bugs into your mouth and into your body. So that, if if COVID's lying here, you're going to infect yourself.
You're going to infect yourself, obviously.
And also wash your hands, soap and water. Think about, you're touching your mask, you've been somewhere, you've been shops, you've taken your mask off, hand gel or soap and water. And wash your hands for that 20 seconds. So just, be thinking about, how you can protect yourself.
And hand gel's okay when you can't wash your hands, but obviously wash your hands as soon as you can after.
Absolutely. Soap and water. There's nothing better than soap and water.
So if you've got an underlying illness, and you've obviously, should you be coming into college, or should you be seriously thinking about working from home where you can work from home?
So the government guidance has just changed this week, and obviously it's variable. So if you're in a area where there's lockdown, then it's obviously it's a little bit more stricter, and it's more likely that that you should be not coming in. The rule is it's not a rule at the moment. It's guidance that if you can work from home, work from home. Now, obviously, that will depend on what you're working at. And I know at college, we're trying to do a blended, trying to do virtual things where you can, and then having face-to-face, when you need to, because we've got to be having a balance. And it's about when can you do that 2 meters social distancing. But if you've got, the key thing is if you're shielding, and obviously the guidance at the moment isn't that shielding, people have to stay at home, which it was. But obviously, as things progress, that might come back in again. But if you are one of those vulnerable people, it's about looking to see, well, what's the risk assessment? Can I work from home? And when you can work from home, because it's not just about when you come in, it's about the traveling, if you're going on public transport, all of those different things will make something high risk or not. But the key thing is if you've got symptoms, don't go. So if you're due to go to college and you've got symptoms, don't go.
No, we don't want
get advice, you get a test, and you follow the advice that you're given, because you might think, oh, it's just a cough, and you might not have any problems whatsoever. It's a cough, you're young, you'll get over it. However, the person you're sitting next to in class, or you might pass them in the corridor, they might not be so lucky, or they might have it, you might give it them, they don't know, and they go and take it to their elderly, their grandma or their granddad, and then they might get ill, and even worse. So it's about just everybody doing their part.
Yeah, it is. And we are currently stressing that as much as we possibly can across college. Most lessons, as you said, are being done remotely, but there is occasions where that can't be done because we've got technical courses as well, so they have to come in. But it is under strict guidelines, and kids, I cannot stress enough, keep the 2 meters distance, and if you can't, just keep a mask on. There is people like myself who are exempt, so wearing a mask keeps us safe. So,
and the other thing I was going to say, Helen, is think about the problem is as well, it's Freshers Week. There's lots, I know most of you are under 18, but I've been to college. We've been there. We know that alcohol is going to be consumed, and the problem with alcohol is that you then get close. You lose your inhibitions a little bit, and people get close together. it's hard. I know you're young, but you are actually going to be young. We're still young.
Yeah.
There's plenty of time for partying and having fun. So just try, and I know it's hard, but these are difficult, unprecedented times. If you could just be sensible and particularly be careful when you're having drinks, because that's when the social distancing goes, and we'll see groups of individuals together, and that is when we get the spread within the community, and that's what we really, really need to tackle. It's very, very difficult, but there's going to be lots of time. This, hopefully, we can get through this within the next few months and be back to back to normality. So just please be patient.
Yeah, it's like people forget the last real big pandemic was the Spanish flu 100 years ago. There was 4 waves of that pandemic, and it lasted 2 years. So hopefully we've actually learned something from that, and it won't last that long. I really don't think I could do 2 years of this.
No. Unfortunately, if you look back at the history of the Spanish flu, there was a war that was, there was celebrations at the end of a war. Yeah. And actually the celebrations at the end of the war, people were so excited that they went out and forgot the restrictions from the flu, and that spread more flu than anything. So this is the problem that we have to think. The reason what we keep having spikes and peaks is because we haven't got it under control, and that's what we have to keep going forward. And hopefully we talked on the other video about vaccines and having vaccinations and the importance of making sure that you take up the offer when they're available. Hopefully we will have a continued scientific development and then a breakthrough that we can get a vaccine over that last hurdle so that we can start utilising it for the mass population.
Yeah, and talking of vaccines, we did have a question about vaccines from one of our students, and the question was, what's the UK doing about procuring the vaccines? Are we trying to make our own, or are we waiting for other countries to sell them to us?
No. So the thing with vaccines is we're very lucky. In the UK, we've got some of the biggest pharmaceutical companies, and all the different pharmaceutical companies will have been looking to see how to make a vaccine. It's like a little bit of a race. They will have been developing, and there are several vaccines that are in quite late stages of trials. Now, clinical trials, and nurses are very much involved in these in clinical trials. Being a research nurse is it's a very different type of nursing, but very exciting. So there is for example, one of the vaccines that had over 10,000 people already been vaccinated across the UK. Because you have a trial, you start it with a few people, one person, you start with a few people, then you do 100
then you do
a few hundreds, and it's called phases, and you have to get to the final phase when it's okay, now you've got a license, and it's just about seeing which one gets to that stage. Now, the UK government and all the other governments, you'll have probably seen on the news, they've been procuring. So what that means is, when they talk about procuring, it means buying. So actually, they've bought various different vaccines, hoping that one of the ones that we've bought for the UK will be the one that is ready first. And I suspect that's probably most likely. So I don't think we need to worry when the vaccine eventually gets the license that it can be utilised. The government have been looking at how they can make sure we've got that ready and that there would be enough supply. What we need to do I work for the Royal College of Nursing, and what my team have been looking at is, how do we do that in reality? So how do we then have nurses vaccinate all the time? General practice nurses in your GP practice, they'll be offering you flu vaccine. Get straight in the queue, get your vaccine. How do we then get to vaccinate a lot of people very quickly? And that's where our team have written a mass vaccination policy, so that we can give the guidance about, okay, this is how we get a vaccine, and then roll it out across the entire population. So that's what's kept us busy over the last couple of months. So we're all ready, we just need the vaccine now.
Yeah, we just got to say, yeah, we're ready. That's it, and then you can all go out, which is really good news. It's something to look forward to.
Yeah, fingers crossed we'll be
Fingers,
there.
we're there. I'll be first in the queue. Trust me.
Mhm.
So obviously over lockdown, we had a lot of people that got overwhelmed about not being able to go out, and we had a lot of mental health
Mhm.
issues that
Mhm.
came along with that. Me personally, I didn't find it that hard because of having problems before. I was sort of used to it. I was used to being stuck at home and not being able to do
Mhm.
anything. So I personally didn't find it that taxing on myself, but I know it affected John, and I know it affected Olivia, and not so much Jason because he was a key worker. He was out and about and doing stuff. So um, what should people do if they come across or they realise that a family member or themselves are feeling a bit overwhelmed? What's the best course of action for them? Is it the GP, or is there another way of doing self help? Is there any self help out there?
Mhm. So I think the key thing is that you know, we look after each other, and you listen and you watch for and you notice when someone's struggling. I think we have to really bear in mind that yeah, we were lucky with lockdown. It was mainly, you know, we had a lovely spring, we had lots of nice weather, but you know, a lot of people still struggled. I think now at this time of year, people struggle anyway. The darkening of nights, shorter days, weather's not so good. You can't get out for a walk. This is a time of year where people struggle anyway, and we need to look after each other. There's lots and lots of different support networks. Your general practice, so when we say general practice and GP now, we don't mean so much, it's not always a doctor. So it could be a doctor or a nurse. It's, you know, you can ring up and you know, ask to talk, but there's also lots of other things that are available. So there's lots of mental health support networks online. I'm just trying to think of some.
We've got quite a few that we have. I mean, at Dudley College, we have got our own counselling system. We've
That's
got
good.
we have our mental health ambassadors, which is I'm one of them. So if anybody does need to talk, just come and find me. I am normally around campus somewhere. We've got a few students that are also mental ambassadors. We've got staff mental first aiders. So we've got quite a good team at college. So there is services available for students if they do feel a bit low, but there's also outside organisations. We've got the Face Trust, who we've been talking to this afternoon, and we have Kelly, come on, give me a clue. There was the Face Trust. We've got a few of us.
There's usually Mind, so you've usually got people like Local Mind. There's usually apps as well that I'm trying to think of some of the apps that you can use, that Headspace, lots of different ones that where you can you can get support to be thinking about how you know, how can you do things different. So for example, I am used to commuting 4 miles a day on the way to work. My life has completely changed. I've gone from commuting to London, going to meetings all the time and conferences, and seeing lots of people to a screen in my office at home. So what I've started doing is this week, because with the darker nights I can't go out for a walk in the evening, I've got started going out for a walk. I get ready for work, go out the front door, walk for 1.5 miles, come back in the front door because that's my commute to work, and then go up to work. And that's helped me, because I thought, actually, I can't go for a walk in the evenings because by the time I finish at 6, it's dark. It's getting dark now. So it's about thinking about, well, knowing yourself as well, and or knowing your family and knowing your friends. I think when you're at college, friends are so important, aren't they? And also friends change. You might have one group of friends and then that changes the next week and you've got another group of friends. But I think it's looking at each other and thinking, oh, well, actually, they're struggling. They're not online, you know, or they might be online too much. How can I reach out to them to say, you know, are you okay? You know, I'm worried about you. What, you know, do you want to talk?
Yeah, what really helped a few of our students is that every Monday and Wednesday at tea time, we used to have tea and talk, and we'd have about 20 students maximum just talking on Microsoft Teams, and that sort of helped a lot of the younger ones. So we are still continuing with that. We're just revamping it at the minute. So we're going to relaunch it after Freshers Week. So we're going to have another system where we got students can just access and talk about absolutely anything. Anything that will just keep the mind off whatever's going on outside of that. So we do that. So that's really good information and what stuff, but do you really think we're going to end up with another lockdown?
Hopefully not. If everyone could just follow the rules. I know it's hard to follow rules, and we don't like, generally we don't like to follow rules, do we? But this is all about how we support each other. And, it's like the 10 o'clock, nobody wants the pubs to be closing at 10 o'clock. But actually, the reason is that because we know after that time, more people are going to get have had more to drink, etc. So please don't think, oh, the pub, that's shut. We'll all go and back and have a party,
No,
because that's defeating the object. And wearing masks and thinking things through and thinking about that social distance, and thinking about, well, I'd love to I'll go and meet my friends, and there's usually 20 of us, but actually that can't happen for now.
No.
So let's think about how we I can keep to the rule of 6, and that's the difficult bit that some groups find it really difficult, because they're used to meeting up in a big group, go down the park and they meet all the mates. The rule of 6 is really needed, because what we're finding is that the young groups that come together, they can have COVID. It spreads rapidly around a group because they're not 2 meters apart, they are closer. You look over someone's shoulder to look at something on their phone, that's too close. And then they're getting COVID, they don't know they've got COVID, and then they're taken back into the community. The reason we'll have lockdown is to stop spread within a community. So if you look at all the areas that are on lockdown now, I think Sandwell's on a local lockdown.
Wolverhampton,
that's why.
And Birmingham. So we literally
Absolutely.
Dudley at the moment is not under lockdown, but all the areas around Dudley, around the outside on the borders, are. So I don't think it's going to be too long before we end up being with them, being this kind of lockdown situation. But do you think the track and trace?
It's really difficult. It's really difficult. Yeah, get download the track and trace app. The whole idea is that we can try and get on top of this and get so as soon as people know they're at risk or that they've been in contact, then they must socially isolate, and that's so important. But again, these are going to be things you don't want to do. But think of the bigger picture. Think about this is about putting a stop to it, because if not, unfortunately, we will go into full lockdown, and we don't want to see that again.
Yeah, we have had a question.
I'd like to continue seeing my family from a distance.
Yeah, even if it's just like this. But we've had a question that somebody said, is the track and trace apps actually effective? Well,
it's very early days. The countries, like Scotland launched theirs a while ago, and that's been effective. And other countries where they've got a track and trace, it's been effective. It's been a little bit slow within England and with the app that we've got now, which covers England and Wales. I think that's been because of people worrying about, we don't want to be watched. This is Big Brother watching us. Actually, I've downloaded it. It doesn't know my full postcode. It doesn't know my name. It just knows where I am through that on that device. And then if I go somewhere, say for example, if I go for a meal, I'll be able to use the QR to so that it knows that I've been in that location. That then gives the technology a chance to see, okay, well, straight away we know everyone else who's been in that locality, and we can tell them straight away. But we've also got nurses and other healthcare professionals that are running track and trace services. So this is a system that we've used for years. So for example, with tuberculosis, we've always used track and trace. So if someone has TB, which is a respiratory disease that luckily we don't get much of these days, but we still do. So if we find someone's got TB, which is infectious, we would then trace. So if you were in, say, a class with that person that had got known TB, then there would be a risk analysis of everybody in that classroom, and we'd work out who needs testing, who doesn't, what's the risk. And that's exactly the same thing that will be happening around COVID. The problem is that, at the moment, if you look at, over 10,000 new cases per day, that is a lot of people to be tracking. So we do need the app, something like the app. But I believe only 70% of people have got the technology on the phones to be able to do that. But at least it's a start. If we can get 70% of the population using this, then that means we can use the other methodology for the other people.
Yeah, which is good. So I'm trying to think. I think we've had a really good session today. It's been very interesting. The information that we've been getting is quite useful. So hopefully other students will find it just as useful as we have today, because although you've only seen me, there is other two members in the room that have been listening. Okay. So you've put Kelly's mind at rest at least. So
that's good. And hopefully also, as well as the COVID and the pandemic and all that situation, hopefully some of you will consider nursing as a career, because it's the best career ever. And I've had 30 years and I hope for at least another 10 years, and it's such a varied career. So if it's not a course you're on now, think of it for the future, because across your lifespan there's always a good time to go into nursing.
So if I'd have just left school, I was 16 years old, and then I was looking for a college course that would lead me into nursing, what would you say was my best course of action? What kind of courses would I be looking at?
Well, I'd speak to your local careers officer and see what's available within. So usually it's a health and social care course. There's all sorts of different types. It depends on what qualifications you've already got, but usually it's to get you to have the A levels to be able, or equivalent to A levels, to be able to go in to do your registered general nursing course. But if you haven't got those, don't worry. There's lots of different ways. You can become a nursing associate, which is a new role in England, which is a foundation degree course. It's a 2-year course, which you then and you become. So it's not a nursing assistant. It's a registered practitioner in their own right, but there's quite a lot of scope to develop that role. So there are nursing associates within general practice, within mental health, within learning disability. There's lots of different options for a nursing associate, and they can stay in that career for the rest of for the rest of their career, or they could progress and then go on to do a registered general nursing course, or they might go on to be a midwife, a mental health nurse, a learning disability nurse, or a children's nurse. There's lots of different options to go on. So you can also, there's lots of other roles within nursing. So the healthcare support workers. There's a whole raft. I could talk. Yeah. If you want any advice, we have a free resource. So if you just Google Royal College of Nursing nursing careers, it will give you some advice. It's all available. You don't have to be a member to get that. So do go onto our website and have a look. But there's lots and lots of different ways that you can get into nursing. You can also do an apprenticeship now. So you can do an apprenticeship where you're going to university, but you're also in a placement. And there's some of those places where you also get a wage at the same time. So you might be in a healthcare support worker role, then you might go on to be a nursing associate. You might do an apprenticeship route where you're still getting paid and you're studying, or you might choose to go to do a formal university where you'll go to university for the 3 years. the good thing with nursing is you're always going to be having placements in practice. So that really gives you sort of a real a mix of experience, quite different to what other students get.
Yeah, that's good. And we'll get Oliver to put a link up to the Royal College of Nursing website.
Yeah, I'll pass you the link.
So yeah, we can get that up for people to have a look at if they're interested. So
Will do.
Thank you very much, Wendy.
That's okay. It's a pleasure.
It's great, and I'll speak to you anyway.
I'm sure you will. And be safe through this for everybody, and we will get through this. And there is light at the other side. So and enjoy your studies. Freshers Week. The future is it's all there, straight ahead of you. Right.
Exactly. So thank you, Wendy, and hopefully we'll try and do some sort of activity in the year where you could probably do a talk with some of our health and social care.
That'd be very good.
Yeah, because we've got level 2s and level 3s, so we'll try and organise something for that for you, so you can have a chat with them.
Fantastic. All right, take care. And thank you for the invite.
Thank you. No problem. Bye.
Bye.
Bye. Bye.